Have you ever wondered if your body tries to warn you before a stroke happens? What if the signs appear 24 hours earlier, but most people completely ignore them? Today, we're going to talk about what a stroke can actually look like the day before it hits, and knowing these warning signs could one day save your life or someone you love. A lot of people think strokes happen out of nowhere. One minute everything seems fine, and the next, someone can't speak, can't move, or collapses unexpectedly. But in many cases, the body sends quiet signals before the major event happens. The problem is that these signs are often mistaken for stress, fatigue, dehydration, or simply getting older. And that's dangerous, because every minute matters when it comes to a stroke. Welcome back to Dr. Waterling Hub, where we break down important health topics in simple, practical ways to help you stay informed and protected. Today's video may be one of the most important ones you ever watch, because we're discussing the warning signs that can appear the day before a stroke and what you should do immediately if they happen. And just a quick reminder, this content is for educational purposes only and is not medical advice. If you ever notice symptoms of a stroke, call emergency services right away and seek immediate medical care. Now imagine this. A 62-year-old man wakes up feeling slightly dizzy. He notices his left arm feels strange, almost numb, but it goes away after a few minutes. Later in the day, he struggles to find the right words during a conversation with his daughter. He laughs it off and says he's tired. That night, he develops a severe headache and goes to bed early. The next morning, he suffers a major stroke. Stories like this happen more often than people realize. Many strokes are preceded by something called a transient ischemic attack, or TIA. Some people call it a mini stroke. It happens when blood flow to part of the brain is temporarily blocked. The symptoms may only last a few minutes or an hour, then disappear completely. And because the symptoms vanish, people ignore them. But here's the scary part. A TIA can be a major warning sign that a bigger stroke is coming soon, sometimes within the next 24 to 48 hours. So let's talk about the warning signs your body may show the day before a stroke. One of the biggest red flags is sudden numbness or weakness, especially on one side of the body. This can happen in the face, arm, hand, or leg. Maybe your arm suddenly feels heavy. Maybe one side of your face looks slightly uneven in the mirror. Maybe your leg feels weak while walking. A lot of people think they slept wrong or pinched a nerve, but when weakness appears suddenly, especially on one side, never ignore it. Your brain controls movement. And when blood flow is interrupted, the body responds quickly. Another warning sign is sudden trouble speaking or understanding words. You may know exactly what you want to say, but the words come out wrong. Or maybe someone is talking to you and suddenly their speech sounds confusing or mixed up. Some people describe it like their brain suddenly freezes. Others start slurring words without realizing it. If someone around you suddenly struggles to speak clearly, even for a few minutes, take it seriously. That is not normal fatigue. Now here's another symptom people commonly dismiss. Sudden vision changes. A stroke warning can appear as blurry vision, double vision, or temporary vision loss in one eye. Sometimes it feels like a curtain briefly comes down over the eye. Sometimes vision becomes dim or strange for just a few moments. Many people assume they're tired or need new glasses, but sudden vision changes can be one of the brain's early alarms. Then there's dizziness and balance problems. Now, not all dizziness means stroke. But sudden dizziness combined with weakness, confusion, blurred vision, or difficulty walking can be extremely serious. Some people suddenly feel unstable while standing. Others bump into walls or feel like the room is spinning. If balance problems come out of nowhere, especially alongside other symptoms, don't brush them off. Another major warning sign is a sudden severe headache. People often describe it as the worst headache of their life. It may come on rapidly and feel very different from a normal headache. In some cases, stroke-related headaches are accompanied by nausea, confusion, blurred vision, or neck stiffness. Now, not every headache is dangerous, but a sudden, intense headache that feels unusual should never be ignored. And here's something many people don't realize. Unusual exhaustion can sometimes appear before a stroke. Some stroke survivors later report feeling extremely tired the day before their stroke happened. Not regular tiredness, deep exhaustion that felt strange and overwhelming. Of course, fatigue alone doesn't mean a stroke is coming. But when exhaustion appears with confusion, dizziness, or weakness, it deserves attention. Here's another subtle sign: confusion or sudden personality changes. Maybe someone becomes unusually forgetful, irritated, or mentally foggy. They may struggle to focus or seem disconnected from conversations. Family members sometimes notice these changes before the person does. And because the symptoms can come and go, people often delay getting help. That delay can be life-changing, Now let's pause for a second because this next part is critical. If you remember only one thing from this video, remember the word fast. Fast is one of the easiest ways to recognize stroke symptoms quickly. F stands for face. Ask the person to smile. Does one side droop? A stands for arms. Ask them to raise both arms. Does one drift downward? S stands for speech. Is their speech slurred or strange? T stands for time. Time to call emergency services immediately. The faster treatment begins, the better the chances of survival and recovery. And here's the truth many people don't hear enough. Strokes don't only happen to very old people. Yes, risk increases with age, but strokes can happen in your 40s, 30s, and even younger. High blood pressure is one of the biggest risk factors. In fact, many people who suffer strokes had uncontrolled blood pressure for years without realizing it. That's why regular checkups matter so much. Diabetes can also increase stroke risk because high blood sugar damages blood vessels over time. Smoking is another major factor. Cigarettes damage arteries, reduce oxygen, and increase clot formation. Excess alcohol, obesity, lack of exercise, high cholesterol, chronic stress, and poor sleep can all increase the chances of stroke as well. And there's one risk factor that surprises many people. Atrial fibrillation, also called AFib. This is an irregular heartbeat that can allow blood clots to form in the heart. Those clots can travel to the brain and cause a stroke. Some people don't even know they have it. That's why heart health and brain health are deeply connected. By the way, if you're finding this information helpful, make sure to subscribe to Dr. Waterling Hub for more easy-to-understand health updates that could genuinely help protect you and your family. Now let's talk about what you should do if you notice warning signs. First, never wait to see if it gets better. This is one of the biggest mistakes people make. Stroke symptoms can disappear temporarily and then return much worse later. Even if symptoms only last 5 minutes, get medical help immediately. Second, do not drive yourself if symptoms are severe. Call emergency services. Paramedics can begin evaluating and helping immediately even before reaching the hospital. Third, pay attention to timing. Doctors often ask when symptoms first started because certain stroke treatments work best within a specific time window. The earlier treatment begins, the more brain tissue may be saved. And that matters enormously, because strokes can change everything in an instant. Some people lose the ability to walk, others struggle with speech, memory, or movement for months or years afterward. But rapid treatment can dramatically improve outcomes. Now here's something hopeful. Many strokes are preventable. That's the good news. Managing blood pressure is one of the most powerful things you can do. Eating healthier foods, reducing excess salt, staying active, sleeping properly, and avoiding smoking can lower risk significantly. Even simple daily walks can help improve circulation and heart health. Regular medical checkups matter too. Many dangerous conditions are silent for years before symptoms appear. You might feel fine while blood pressure, cholesterol, or blood sugar slowly damage blood vessels in the background. That's why prevention is so important. And let's talk briefly about stress. Chronic stress doesn't directly cause every stroke, but long-term stress can contribute to high blood pressure, poor sleep, inflammation, and unhealthy habits that increase risk over time. Your body keeps score. Taking care of mental health matters more than many people realize. Now imagine this situation. A woman suddenly struggles to hold her coffee cup one afternoon. Her hand feels weak for a few minutes. Later that evening, she experiences brief blurry vision and a strange headache. She thinks she's exhausted from work and decides to sleep it off. The next morning, she wakes up unable to move one side of her body. This is why recognizing early signs matters so much. Your body may whisper before it screams, and one of the most dangerous things people say is, "It's probably nothing." When it comes to stroke symptoms, it's always better to be cautious. Even doctors would rather evaluate someone who turns out to be okay than miss a potentially life-threatening stroke warning. Now there's another important point. Sometimes stroke symptoms appear during sleep. A person may go to bed feeling mostly normal except for mild dizziness, confusion, or headache and wake up with major symptoms. That's why sudden nighttime symptoms should never be ignored. And if someone around you is acting strangely, don't assume they're simply tired or dehydrated. Trust your instincts. Family members are often the first to notice slurred speech, facial drooping, or confusion. You could save a life by acting quickly. Let's quickly recap the possible warning signs that may appear the day before a stroke. Sudden numbness or weakness, especially on one side. Difficulty speaking or understanding speech. Sudden vision problems, severe dizziness, or loss of balance. A sudden intense headache, confusion or unusual mental fog. Extreme unexplained fatigue, and symptoms that come and go unexpectedly. These signs should never be ignored, especially if they appear suddenly. And remember, even temporary symptoms can be dangerous. Before we close, here's something worth thinking about. Most people spend years planning vacations, careers, and retirement, but very few spend time learning how to recognize a stroke. Yet that knowledge could one day save a parent, spouse, friend, or even yourself. Sometimes the difference between recovery and tragedy is simply recognizing the warning signs fast enough, so take this information seriously. Share it with people you care about. Talk to your family about stroke symptoms. And if you ever notice the signs, act immediately. Again, this video is for educational purposes only and not medical advice, but when it comes to strokes, fast action can truly save brain function and save lives. If you learned something valuable today, make sure to subscribe to Dr. Waterling Hub and turn on notifications so you never miss important health updates like this. Thank you for watching. Take care of your brain, take care of your heart, and never ignore what your body may be trying to tell you.